Hello viewers, this is the Master Medic, and today I'm bringing to you everything you're supposed to know at this side of the care plan sheet as well. So right after the front page, or right after you are done with the front page, you quickly move to this side of the nursing care plan sheet. So quickly you come to the medication, name of the words, the medication, the date ordered, date completed over here. So what medication was ordered for the patient? So if it is paracetamol, IV paracetamol, let's say 500 milligram or whatever being the dosage that was given to you, you write it there. So you write the name of the medication, date the medication was ordered, date completed. If your medication is not a start dose, do not write the date completed. Just write not yet, because you don't know when patient finished taking the medication or patient will finish taking the medication. So for that reason, you, the nurse, you don't have to also predict the day that patient will finish the medication. If it's a start dose, since start dose medications finish or get finished on the same day, that same day, you write the date ordered at the date completed. Is that okay? Very well. Let's come to other treatments. Other treatment, this is where the other therapies that patient is supposed to undergo to help patient recover from his or her condition are supposed to appear at. So if patient was told to go and see a dentist for a review, you come and state it here. So the date that order was made, you write it here. Note that the physiotherapist review, the dietitian review, or whatsoever, all other treatments, those treatments are supposed to be here. The dates that those treatments were ordered, you state them here. The dates that they were completed, you state them here. So provided the patient has not yet attended this this order, or patient has not yet gone to see the physician or the therapist or whosoever being the person, you don't write the date completed at this side. Now, if there is no order made in the scenario, write not ordered, not ordered. If there is no order made in the scenario, write not ordered, just here. Then you come to your investigation. These are the labs, the things that patient was told, the labs investigations the patient was told to go and do, or patient's blood was taken for, or patient's urine, patient's stool was taken for, or the x-rays, the scan, all of those things that were done on patients are supposed to be. So the date that all of those things too were ordered, you write it there, and then the investigation, the type of lab test or the investigation that was done on the patient. So at the results side, the results are not yet in. If the results are not yet in, you write pending results or awaiting results.